Today. My colleague Samantha Meltzer-Brody, who is the chair of psychiatry here at UNC, and who, for those of you who attended our summit in the fall, which we were thrilled to get such great response. Unfortunately, Samantha, Dr. Meltzer-Brody couldn't be with us today, so she and I pre-recorded a quick presentation regarding the various steps that we have taken. So we're going to show that first, and then we'll have a series of updates. Ed Fisher and Samantha Liu will talk about some of the resources that we have offered, the activity that's been happening in Peers for Progress, and the resources that we have to share regarding peer support at Carolina. And then Avery Cook from CAPS is going to come in and talk a little bit about the activity that we've been engaged in at CAPS, and then we'll open up for Q&A. So we have a full agenda today, and hopefully lots of time for Q&A and discussion at the end. But first, what I'd like to do is to kick it off with our presentation that we, again, pre-recorded from me and Samantha. And I will say there's a quick update here regarding how to participate, so that you can see that there will be an opportunity for discussion. There's a note there, if you'd like to remain anonymous, we do have an opportunity for folks to submit questions and comments using the Q&A feature, or if you'd like to directly ask a question to the panel, you can message Caroline Carpenter and she'll add you into the queue there for that. We will be recording and it will be shared online for those who can't make it today. So I think with that, then we will turn it over to the recording that Samantha and I did, I think just last week, to talk about some of the activity that we've been engaged in over the course of the last semester and a little beyond that. So take it away. Good afternoon, everyone. I'm Amy Johnson, the Vice Chancellor for Student Affairs, and very glad to be here to share a student mental health update with you all, with my good colleague, Samantha. Meltzer-Brody. Samantha, would you mind introducing yourself?
Yes, hi everyone. I'm Dr. Samantha Meltzer-Brody, and I'm the chair of the Department of Psychiatry in the UNC School of Medicine.
As noted, we are here to talk about an update regarding all of the activity that we've been engaged in over the course of the last several months since we last came together for the Mental Health Summit in November. And I'm pleased to report that we have a number of new initiatives and features and resources for the campus community that have been launched. And we wanted to share those with you today and be able to answer questions following the conclusion of the program regarding any of the activities that we've been engaged in, but also to discuss what's next for the future. So let's start with what's the latest. And one of the key initiatives that we have entered into, as you'll see in that first bullet, is a contract with UWIL, which is a telehealth services provider. UWIL is affiliated with one of our national associations in student affairs, and we were interested in signing into a partnership with them because they know higher education and particularly college students well. And in particular, one of the key pieces of feedback that we have heard throughout this process, and especially during the summit, was that students were interested in accessible anywhere telehealth care. And so the contract and the relationship with UWIL, which has been in place since last October, actually gets us that, both in terms of students' ability to be connected with a counselor from the comfort of their own home home or their office or whatever is most feasible for them, but also at 11 o'clock at night, for example, when our CAP staff aren't in the office. So we have entered into this agreement as a pilot for this year, and we'll be reevaluating it at the conclusion of the year and assessing whether or not we continue the telehealth services, which I fully expect that we will due to the response so far, but whether we continue that relationship with UWill or consider another provider based on feedback. So that's the first piece that we've been involved in. And Samantha, do you want to cover the JED campus relationship?
Sure, I'd be happy to. So with the support of the Chancellor and Vice Chancellor Amy Johnson, we became a JED campus in February of 2022. What does that mean? This is a national organization that is focused on reducing suicide and reducing risk on campuses, and they've had great success nationally. We have completed the initial JED campus task force by completing this pre-test questionnaire recently. There is a Healthy Mind student survey that's scheduled for this fall in September, and our first JED consultant campus visit will be this October 2022. Being part of JED and being a JED campus is a very important step forward in addressing mental health and suicide prevention for UNC.
The next piece that we wanted to present to you, and I hope many folks in the room have had an opportunity to participate in these over the course of the spring semester, is starting in February. As we agreed at the end of the summit, we wanted to continue the conversation that we'd started there. And we recognized too that there were particular areas of focus that folks had mentioned in the summit and subsequent to the summit that they were interested in taking a slightly deeper dive into, talking about the intersection of key topics and mental health. And so we launched this mental health seminars program as an opportunity to do that. And typically in each seminar, what we have is a faculty presenter who kicks off the conversation, lays some foundation in terms of what we know from research and theory regarding this intersection between the particular topic and mental health. We have a panel of experts who come in and also share some of their insider wisdom and expertise and experience, particularly with a practice focus often. And then we answer questions for folks in the room. So in February, we did our first mental health seminar on faith and spirituality and mental health. In March, we tackled mental health, alcohol, and drugs, as you can see. And the last and most recent seminar that we did was identity-based violence. And we expect that we will continue this series for the coming academic year, but we're very interested in getting feedback from folks regarding what additional topics we want to discuss and whether or not there are, beyond the seminars, other ways we want to continue this conversation that we started at the summit. So we'll be interested in talking more about that in the coming weeks and months.
One of the next things we wanted to highlight was a new partnership that we're thrilled to have established between CAPS and the Department of Psychiatry and the School of Medicine. So the Department of Psychiatry, the Medical Center are, essentially right next to campus health. And this is an opportunity for our child and adolescent psychiatrists, other psychiatrists to be directly involved in patient care to students for 3 days per week, focused on assessment, medication management as needed. And it's really wonderful to have this partnership in place. I think it will increase our ability to be as responsive and as helpful for psychiatric care to the UNC community seeking help through CAPS.
We are really enthused about that relationship, and thank you so much, Samantha, for being willing to partner with us on it. That's wonderful. For our last slide today, we have a couple of big news items. One is when we had originally done the summit in fall, as mentioned, fall 2021, I should be clear to say, we had this great idea that we would have a bookend with a mental health colloquium at the end of this academic year. And unfortunately, due to scheduling and just the crush of the end of the semester activities, it turned out that we were trying to plan the colloquium at a time, I think, that really did not work for students, faculty, and staff. So what we agreed to do is this update today to continue the conversation and use the colloquium rather than a bookend to this academic year as a kickoff to the next academic year. So in fall 2022, we will hold our colloquium and we'll use that as a jumping off point to talk about what are our well-being needs for the future, what have we accomplished, what is the work that lays ahead, and what are our needs now. So that's the plan for the colloquium in the fall. Stay tuned for more information about that. We hope to have a big splash and a lot of promotion regarding that particular activity, which again, we anticipate will probably be about a half day. So stay tuned for more on the colloquium. The other piece that we're extraordinarily proud of that has involved the work of hundreds of folks across the campus. And so we are incredibly grateful that our Carolina community has come together to create the Heals Care Network, which is both a philosophy and we have a website dedicated to the network. One of the messages that we heard loud and clear and was a big focus of the summit and certainly has extended as a focus for us more broadly is the desire to create a culture of compassion and care at Carolina. And we needed a particular way to manifest that work, aside from just saying that this is something that we want to help reinforce and extend. So we have created the Heals Care Network website, which you'll see in front of you on the slide, a quick snapshot of the front page so you can get a sense of the resources that we have. And I want to just highlight a couple in particular, but I encourage you, if you haven't already gone to the Heals Care Network website to check it out, please do so, because there's just a wealth of resources available there, and it is constantly being updated. One of the things that became a challenge, a particular challenge for us, but is a real asset at the same time, was the myriad of resources that we have for mental health and well-being across this campus. But unfortunately, we didn't have them collected all in one place in an easy to access format for everyone. And the other thing that we had heard from folks is, I know there are probably a million things out there for me, but how do I pick? And so in particular, at the center of the slide in that top blue box there, you'll see listed a resource hub reference. This is a feature of the Heals Care Network that again pulls together in all in one searchable database the resources that we have across campus and allows you to identify some particular interests and have then the database create for you a list that might be a really good set of options for you to pursue for your mental health care needs or in support of someone else. So please do go check out that resource hub. If you know of additional resources on campus that are not listed here, let us know. We are adding to this all of the time. And it's really something that we're very, very proud of and that we want to make sure works for our community. In addition to the resource hub, as you'll see on the main page, we have information for how to get help immediately and perhaps the best way to pursue that help based on whether or not there is a high level of urgency, or you just want to talk to someone, or you're interested in getting set up for an appointment. There's a series of trainings that are available for the campus community that are also identified by area of interest and scope. There's a student's peer support connection here that you'll see, some particular suicide prevention strategies, and a care referral. And then another piece that I absolutely want to call your attention to in the lower right corner there, as you'll see on that screen snapshot, is peer chat. And we have partnered with our colleagues over in the Peer Support Corps, led by Ed Fisher and Samantha Liu, to have this peer chat feature staffed by folks who are students who are trained in being able to talk with students, faculty, or staff, and to connect them with the appropriate resources and potentially also, just be a source of some preliminary information for you as well. We call this feature Listen, and we are thrilled with the response that we have received from the campus community in terms of utilization of this particular feature, and want to make sure that we continue to get the word out about this. We know that especially for students, this is highly sought out and sought after and used. And so please help us make sure that folks know that there are available peers to chat with you right by going to the Heals Care Network and help you get connected to the right place. So with that, Samantha, I think we want to thank you so much for being a part of our presentation today. And we look forward to continuing the conversation. I know we're going to have some additional presenters and then a Q&A section at the end, but we're really so pleased for our campus community's interest and response to creating a culture of compassion and care, and particularly to the campus-wide team of folks that have come together to provide that response. The Heals Care Network really is an effort that is designed to reinforce that there is a role for everyone on this campus community to play. We all have a responsibility to support the mental health and well-being of our campus community, and we're extraordinarily appreciative of all the partnership that we've received to do it.
Now, that's wonderful. And it requires all of us doing our part. And so it has been so encouraging, given the mental health crisis we are facing now, to see the commitment and the dedication and just the roll up their sleeves and get involvedness of people so broadly. So we are really looking forward to next steps.
Thank you all. And we'll turn to the next feature in our program. Fantastic. I hope that was a useful overview for everyone, and so grateful for Samantha for her continued involvement. I should say Samantha Meltzer-Brody, because we have a couple of Samanthas, don't we? Samantha Meltzer-Brody and her terrific partnership with the Department of Psychiatry and the relationship that we're building there. Again, just one example of the many, many relationships that we are building and extending across campus to support our community's mental health. And speaking of partnerships, we've got a couple of other great buddies in the room. So Dr. Ed Fisher and Samantha Liu from Peers for Progress are here to talk about the peer support resources that we have developed and their leadership and expertise in extending that and what we have to offer. So Ed and Samantha, can I hand it off to you?
Terrific. I just want to echo what Amy and Samantha Meltzer-Brody were saying at the end of that video, and just emphasize, I think it's really important that the campus really gets it, that mental health and well-being is a campus-wide campaign, not a single service or single best practice or single treatment. There are all sorts of things that go into addressing these challenges on campus. And I'm really delighted to be part of the efforts led by Vice Chancellor Johnson and Dr. Meltzer-Brody in really pushing the envelope to capture a wide range of activities and services in these areas. So within that context, we'd like to talk about what's happening with peer support on campus. And perhaps the most important part of our presentation here is the quote from President Biden. This is from his inaugural address, which just captures the idea that's central to everything we're doing, that peer support is not some intervention that has been discovered or invented, but rather peer support is as old as humankind, and it's natural, it's part of our everyday life. What we are trying to do here on campus is promote it, extend it, make it better, make it more accessible. And I just want to point out that in addition to Samantha Liu, who Amy has already introduced, we are very blessed to be joined by Patrick Tang, who's the program manager of Peers for Progress, which is the overall umbrella that our UNC Peer Support Corps is part of. Caroline Carpenter has been a wonderful Chancellor's Fellow and actively worked with us all year and made tremendous contributions to what we do. And Debbie Clark in the Provost's office has been our liaison to South Building and to numerous other groups on campus, and has been a tremendous resource for us and really a supporter of our work. We adore Debbie and appreciate all that she's done. So Caroline, the next. So I'm just going to make a couple comments here before Samantha talks more about exactly what it is we're doing on campus. First of all, just to point out that there is research, there is lots and lots of research that I would love to bore you with, but won't, on the role of peer support in health and healthcare and chronic disease management and mental health from around the world. One of the most striking papers was with reducing postpartum depression through peer supporters in Pakistan. But a relatively recent review of mental health interventions among university students identified that peer support interventions had the greatest effects for depression and generalized anxiety. So within the focus on university students, there's emphasis on peer support. And then this was echoed in the Mental Health Task Force a couple of years ago, which recognized peer support as an important strategy to promote well-being and mental health on campus. So with that, I'm going to turn it over to Samantha, who will tell you about more of the details of what we're doing on campus. Samantha, take it away.
Thanks, Ed. So with the next slide, please, I'll just highlight a few examples of peer support across our campus community. This is not at all an exhaustive list of all the things going on, but I just wanted to illustrate the spectrum and breadth of some of the activities that are happening across campus in relation to peer support and social support. So, and all the links that are featured on our slides, I've sent in the chat if y'all would like to access them. So starting in the top left corner there is the Carolina Collaborative for Resilience, which operates out of the University Diversity and Inclusion Office. There are available and trained staff resilience coaches through that program who span a number of different personal identities across gender identity, racial identity, religious background, a number of things. And students can request to speak with those trained peers on the basis of that identity to address identity-based traumas. And so that's one program that's available. It illustrates peer-to-peer support that's one-to-one of staff to student support. On the bottom left corner is peer-to-peer. It's a program that's been founded by undergraduate students, though it serves all UNC students. Through this program, a student can go to the peer-to-peer website, view the biographies of a number of different volunteer trained peer responders, and request to speak with one of those students. So it's a student connecting with another student on whatever basis that they'd like to speak about. Dr. Johnson mentioned earlier the LISTEN program, which is available through the Heals Care Network, and that's in the center there. And this is also one-to-one peer support that's available with trained peer supporters called listeners, and that's available currently through a live chat window. And so that's also available to any student at the Carolina community, but also faculty and staff can access the listeners to help them navigate resources. The listeners are trained to listen, of course, provide support, as well as to help students get to the right resource at the right time that they may need. So those three programs are just examples of one-to-one peer support relationships that is a small portion of what happens at UNC Chapel Hill. The next ones are examples of mutual support in group settings. So the UNC Chapel Hill Wellness Network is a program for and by undergraduate students specifically, in which trained facilitators meet periodically in groups to hold meetings and to give and get mutual support from other students. In the center there is an example of a support pod, in this case within the Gilling School of Public Health. These are folks who are connecting on the basis of a racial identity. And this one is interesting because it's for anyone of that racial identity, whether they're a student, staff, faculty member, postdoc within the school. It's another example of mutual support that's happening across campus. There's a number of different pods that also meet. So those handful of small examples are some of the things that are a bit more formalized. They've got meeting times, they've got different processes through which you can connect with the peers and get social support across campus. But I really like this photo on the right-hand side as well. In the foreground, it illustrates just folks meeting and talking to each other. And so that can just be like informal game nights, for example, or over shared common interests. Someone started a platform that's called a Grad Connect, where graduate students and professional students can connect on a basis of a number of different interests that they might have. It could be students getting together talking about a project that they have in a classroom. But in the background, I really like the union cubes, which many people are probably familiar with. Those cubes span the student groups, organizations, fraternities and sororities, sports teams, performance groups, all of these organizations which are not necessarily primarily focused on mental health of their membership, but they're a space through which people find community. They're a space through which they connect to other people and get and obtain peer and social support. So I offer all of these examples as just to illustrate the breadth of all the things that are happening at UNC Chapel Hill and all things that we embrace as good things, good sources of peer support that are happening across campus. Next slide, please. In addition to specific programs, we also think about how peer support and social support can be integrated into the campus across a number of different initiatives. So we mentioned the Listen program and how that was created in conjunction with the Heals Care Network. We've also worked in academic setting, thinking with the Ideas in Action curriculum and the First Year Thriving course about how social support can be integrated into some of the skills and topics that first year students will be learning about and taking forward throughout their career as a Carolina student. And then I'm so glad to highlight and give gratitude to the Carolina Peer Support Collaborative. This group currently includes over 100 individuals representing 50 groups, organizations, departments across campus. All the individuals in the collaborative are people who are doing the work. They're the ones who have an interest in the mental well-being of our Carolina community, specifically through thinking about how peer support can be implemented across campus in different forms. Those programs that I highlighted, in addition to just thinking about how messaging and communications can be more promoting of people reaching out to each other and getting support from each other. Across our work within the collaborative, outside of it, we also think about how peer support can be useful towards working towards health equity. So we try to emphasize distress that's rooted in racism and injustice, in addition to distress that's rooted in academic or career related topics. We think about the proactive engagement of high priority groups across campus, and then to further integrate a lot of these activities and messages, we also try to articulate overlaps and common causes that we share with campus-wide initiatives, like those coming from DEI offices, or those that contribute to build our community together, which is part of the Carolina Next strategic plan. Next. So all of this is just to illustrate some of the work that we have been doing with the UNC Chapel Hill Peer Support Corps over the last 2 years and hope to continue to do. Our strategy, as I've tried to illustrate, is that there are many programs and sources of peer support at UNC Chapel Hill. We embrace, recognize, and want to promote all of them. The objectives that we are working towards are to increase the range, access to, and perceived availability of a lot of these services and activities which promote well-being, especially those around peer and social support. We want to make sure that we're using peer and social support to increase our reach to and engagement with high priority groups across campus. We also see that peer and social support is a vehicle through which we can increase morale and the feeling of belongingness within the Carolina community. We think about that not just as the Carolina students, but also thinking about our broad community inclusive of staff and faculty. So those are some of the specifics on our work. We're happy to take questions later on. I'm going to pass things back to Dr. Ed Fisher to give us some broad strokes.
If I can have the next slide. Thanks, Caroline. Doing this work has taught us a lot and provoked a lot of thinking about what well-being and mental health are and how to promote them in a huge community like UNC. And what our current best ideas are what we call 2 dimensions and a key word. The first dimension is a continuum of well-being and mental health, from daily hassles to serious, even life-threatening problems, from a student who gets a bad grade on an exam for the first time in their life, or a breakup of a romantic relationship, on out to people who are having really serious, very challenging problems that they're having trouble dealing with. And it's really important to understand that that's a continuum. There's no sharp dividing line between normal problems and mental health problems. It really is a continuum, and recognizing and validating and valuing the entirety of that continuum, that the person who's struggling with a conflict with a roommate, that's real, and it needs to be understood and recognized, just as somebody who's perhaps deeply depressed or experiencing hallucinations. And parallel to that continuum is a continuum of resources, from a roommate who gets it to highly expert therapy. And again, there's a lot of points along that continuum, peer support, and all the kinds of activities that Samantha just described, all can be placed on that continuum. And it's really important, again, to value the entirety of that continuum as we, as a campus, as a community, try to address these challenges among us. And then the word is complementarity, which applies to all points on both continua. So the first-year student who's experiencing a romantic breakup may be helped by a highly experienced counselor who has spent a lot of years working with undergraduates, and somebody who's got serious mental health problems may be helped by somebody who has been there and has dealt with those problems. The point that we sometimes make is sometimes you really need to talk to somebody who's had lots of experience dealing with complex problems. And sometimes you need to talk to somebody who knows what it's like to live in a freshman dorm. And usually the two people are not the same. And so understanding that complementarity across both continua is really, I think, a really important way of conceptually guiding the broad approach that Dr. Johnson and Dr. Samantha Meltzer-Brody are articulating for the entire campus and our approach to these challenges among us. Finally, we want to talk in the next slide about going forward. And first of all, just to note, redundancy is not a four-letter word. There's a lot of similar things that are available from the services and activities that Samantha mentioned, from CAPS, from the Department of Psychiatry, from the clinic and the Department of Psychology, from student wellness services, from the Carolina Covenant program, from the Dean of Students. Redundancy is just fine, because we need to have lots and lots of doors through which people who are facing challenges can walk, and it needs to be easy for them to find a door through which to walk. And the Heals Care Network that Dr. Johnson described is really important then in making those doors available to people, so people can find them rather than feeling lost and confused among them. And I want to close by talking again about campus culture. The Mental Health Task Force in 2019 said, we've got trouble here in River City. There are some problems with the campus culture of too much feeling that busier is better. A graduate a year ago just chilled me when she mentioned in a meeting that she felt the culture reflected an idea that you're only worth what you produce. We think peer support, the fact that I can help you today and you can help me tomorrow, and we all need help from time to time, we really think that peer support can underscore what Dr. Johnson describes as a culture of care, a culture of caring, a culture of mutuality, if you will. And it's really, really important as we pursue those to recognize that individual achievement and excellence are not compromised by support and care. It's not that the only people who achieve are lone rangers who never talk to anybody else about any kind of vulnerability. Rather, supportive environments facilitate individual and group achievement, which is, after all, what we're all about here at UNC. So with that, I'd like to turn it back to Dr. Johnson and the next speaker.
Thank you so much, Ed Fisher and Samantha Liu. Really grateful, as we've mentioned, for your partnership and the collaborative approach with which you have come to the table and all the great resources that you're offering to our community. Thank you on behalf of all of us. And with that, I would love to turn it over to my colleague Avery Cook, who is, as noted earlier, our interim director of CAPS and a practitioner as well, to be able to talk a little bit about what we've been doing at CAPS and to address the resources that we have there, and also some of the concern and confusion we know about access to CAPS that exists out in the universe. So with that, Avery, can I please turn it over to you to talk about the good things that are happening over at CAPS?
Sure. Thank you so much. It's wonderful to be with all of you today. Here at CAPS, we have certainly been acutely aware of the mental health challenges and the discussion that has occurred on this campus, not just this year, but ongoing. And certainly the struggles that have been exacerbated by the pandemic that we've all been living through over the past 2 years. At CAPS, this year, we have continued to focus on the immediacy of care. We want to make sure that students who need to connect with mental health services are able to do so really at any time. This starts with our CAPS 24/7 approach, where a student is able to call the main CAPS number at any time, day or night, and speak with a therapist in that moment. So that means at 3 a.m. on a Saturday night, if a student calls our number, they speak with someone. They speak with a trained clinician. That includes holidays, it includes weekends and evenings. We want to make sure that if a student's in distress for any reason, or if they just need some support, that they're able to get someone. This also has looked like, as Dr. Johnson talked about earlier, the addition of UWIL services, which not only expanded our reach with brief therapy, but also allowed students to access therapy at times that CAPS isn't open. So UWIL therapists have night and weekend hours to better expand the access to care for folks. And then here at CAPS, we have continued to do our initial walk-in service. This has been something that's been available at CAPS for more than 10 years now. And it's any student who wants to initiate any type of service or get some support in the moment is able to walk into CAPS at any time, Monday through Friday when we're open, and meet with a therapist that same day. The process is really simple. A student simply walks in, we ask that they fill out a little bit of paperwork so we get some information on them, and then they will sit down and meet with one of our therapists to talk about what brings them in that day, and then they will leave with a plan for next steps. And here at CAPS, that can look like a lot of different things in terms of next steps. It can look like connection with one of our medication providers for medication evaluation or ongoing medication services. It can look like connection to one of our groups. CAPS has offered more than 25 groups each semester this year of varying lengths and with varying focus. It can also look like connection to psychotherapy. Here at CAPS, we provide brief psychotherapy. We don't have any session limits. Instead, we operate on a brief therapy model, which just looks like an approach that is really wonderful for issues that are emergent and things that haven't had treatment in the past. And for that, we will connect a student either with one of our therapists here or with UWIL to have that sort of brief therapy experience. Typically, that looks like about 70% of the students that come into CAPS looking for psychotherapy are served in brief therapy at CAPS. There are about 30% each year that come in presenting with concerns that they've been in treatment for a while in the past, or have been in ongoing treatment in the past, and they're wanting to continue that care. And so they're looking for more longer term or more open-ended therapy. For that, we help students connect with a therapist in the community, and we do everything we can to make sure that a student is not only able to connect, but is able to find that person that's the right fit for them. So some of our therapists at CAPS also serve as referral coordinators. So they will work with a student to look at all of the factors of what they're looking for, and then refer to the list of therapists in the community that we keep track of to help make sure that we sort of help them make that connection. That means we are able to search for therapists with different insurance plans, with different identities, with different areas of specialty or areas of interest, in different locations who provide in-person therapy or online therapy. So we really sort of do everything we can to sort of make sure there's that fit. And then there could also be sort of any number of different places that we also help a student connect to during that initial walk-in. It could be a different office on campus. It could be peer support. It could be helping them connect with a student group on campus to increase their connection. Either way, we want to make sure that when a student leaves that day, that they have a plan for things that are going to be helpful for them as they're moving forward. There were some concerns in October when CAPS, for a very short period of time, went to a wait list for that brief therapy. We had our wait list open for about a week before additional resources were sort of brought our way to clear that up. It was the first time in 14 years that CAPS had a wait list for brief therapy. In the world of collegiate mental health, that's pretty rare, particularly at a university this size. So we have been very lucky to be able to meet students' needs in the way that we have. Since that week in October, there's been no wait for psychotherapy, for brief psychotherapy at CAPS. Students have been offered appointments immediately after that walk-in experience. And that is our goal and our plan moving forward. We want students not only to have immediate access to care, but we want them to be able to have all the support that they need to be able to really thrive both personally and academically. And that's always our goal. I'll just speak really quickly to two other programs that we've developed over the past couple of years that may be of interest. The first is our embedded counselor program. So we have some professional schools on campus that have started an embedded counselor program. Right now, it is the medical school, the BBSP program, and the law school. In the upcoming year, we're looking to add those into the School of Public Health, the journalism school, and the pharmacy school. So these are dedicated CAPS therapists who are embedded in those programs and focus on those students. The positions are paid for by those programs, so that allows the students to sort of have that, allows the therapist to kind of have that focus, but they get to know the culture of the program, they get to know the students, they get to really connect with them that way. We've also started the multicultural health program, which is 4 of our therapists that are dedicated to increasing access and outreach with underserved students on this campus. So particularly our BIPOC students, our Asian American students, our Latinx students, we are really wanting to make sure that those therapists work with different student groups and organizations to do increasing outreach and really provide services that are needed to those students and make them feel connected. And those therapists have done an outstanding job. We also hope to add 1 more therapist to bring that up to 5 in the upcoming academic year. So CAPS sort of continues to get creative with our focus, but more importantly, we are listening to what students are telling us that they're needing and trying to adjust our approach to make sure that we're meeting them where they are to give them the support that they need. And as we move forward, I'm happy to answer any questions that folks have.
Thank you so much, Avery. Really appreciate that. So we have, as noted, officially moved to the Q&A and discussion part of the program. Carolyn, thanks for bringing up that slide that talks about the options for folks. So you have resources to be able to ask directly if you would like and message Caroline Carpenter. If you would prefer to remain anonymous, you can submit your questions through the Q&A feature. And I see that it looks like we've got a couple of those already in the queue, and then the chat is also available if someone would like to submit a question that way as well. So the remainder of our time we have open for discussion, and please, I hope folks will feel free to ask any questions that they have or share comments or feedback that may be useful for us as well. So with that, Caroline and Allison, do you want to direct us to the appropriate question? Or it looks like I can maybe just open up the Q&A to start, and then maybe you can let us know if we have other questions that have come in indirectly. So the first question for the group is, since graduate and professional students are often in different places in their lives than undergrads, what ways are you using to assess their wellness and needs? Assessing those who are non-traditional students is different than the traditional 18 to 20-year-old age group. So thanks for that question. Maybe I'm happy to start with sort of some quick observations, and then I turn it over to my colleagues. You know, I observe that we do this in a number of ways. One, the assessment particularly is often done directly in the units that serve these students and are facilitating the work. So I know that we do assessment directly in CAPS regarding the students who access CAPS, and Avery, maybe if I could turn to you at an appropriate point and you can talk about that. Our student wellness team, which is also our group that does a lot of education and promotion. They serve as advisors to our Healthy Heals program, for example, and do work directly with graduate and professional students, in particular partnering often with the schools that serve graduate and professional students. They do assessment on their particular programs. And unfortunately, we don't have anybody here from student wellness today specifically to speak to that issue, but please know that that work exists. We also do a climate survey, which we are planning to launch, as I understand it, this fall, which addresses graduate and professional students' needs. And then the graduate schools, the graduate school and the schools that support graduate and professional students also do their own assessment, research, and programming. For example, I know I just participated in the program that the graduate school offered that was the Surviving and Thriving program out of the Stone Center. And so there are myriad ways, I think, both globally and more locally, that we do assessment and are able then to inform the practices and the programs that we offer to those students. We have relaunched just in student affairs. I'll also speak to just a quick note. We have launched our Student Affairs Council, which has representatives not only from those of us in the Student Affairs Division that obviously do this work, but partners across the university, in schools and centers and beyond. And as a matter of fact, we're going to be talking about supporting graduate and professional students as one of the focus of our meeting coming up, I think, in the very beginning of the academic year. So we have an opportunity to touch base, and we'll talk about some of the assessment and the programming work that we're doing. Avery, are you able to maybe sort of share from your perspective what you're hearing about how our graduate professional students are doing in ways that you assess? Maybe talk a little bit about that sort of post-visit client assessment that you do and what you're learning from that.
Sure. So yes, we absolutely are hearing from graduate students in individual programs. It has led us to start specific groups for graduate and professional students, as well as our multicultural health program did a series of workshops targeted for graduate and professional students. We also have continued to work individually with programs as they contact us to learn more about things that are going on. We've provided trainings as requested for different programs. I'm doing one next week, I believe, for the pharmacy school on how to support students. So we're sort of taking in all the feedback as it sort of comes in and as things sort of evolve. I know graduate professional students also were hit differently in the pandemic than perhaps our undergrads were. And we certainly heard about that as well. But as we sort of hear more from these graduate students, it really does impact, at least here at CAPS, sort of the things that we offer in terms of services, in terms of groups, in terms of workshops and outreach.
Perfect. Thanks so much, Avery. Ed and Samantha, anything else that occurs to you that might be important to reference here for grad and professional students?
Sure. I'll just briefly add that many of our collaborators within the Carolina Peer Support Collaborative are folks who serve graduate and professional students directly. And so they're folks from the graduate schools, from the professional schools and such. And so we try to be proactive about reaching out to them. But if there are folks who want to be involved, definitely let us know. But many of them have thought about, similar to CAPS and many of the other groups, having specific spaces for graduate and professional students, but also thinking about making it clear that many of the resources available to students are also available to graduate and professional students, and making sure that folks understand that it's not just for undergraduate students. During our presentation, I think I briefly mentioned one initiative called Grad Connect, in which several graduate students got together and wanted to just create a space where people could connect on a bunch of different interests and topics. And so I'll drop a flyer for that in the chat if anyone's interested. But that's just one specific resource and space that our collaborators work together on to create specifically for graduate and professional students.
Yeah, and I would just add, I really appreciate the question, because I think the needs are very specific frequently to grad and professional students. I would also add international students. Many of the international scholars that we have visiting us for graduate degrees or for visiting scholar roles also have similar, well, not similar, but also have unique needs and challenges. And Avery, I'm not sure you mentioned, but the embedded counselor from CAPS is really an important CAPS service for this. I know the people in the School of Public Health are very much looking forward to having the embedded counselor get established in the school, which is largely graduate and professional students in the next year. So that's another one. And I just would add that from the get-go, really one of the people who most encouraged the development and has continued to be a real supporter of the Carolina Peer Support Collaborative that Samantha mentioned is Dean Barber of the Graduate School.
That's great. Thanks to you all for that. Appreciate it. The other question that I see in the Q&A is, I work with graduate health profession students. I'm curious if there are any new resources targeted toward this population. In addition, I'm curious about resources that particularly address burnout and resilience. So I think we've sort of talked around some of this issue. I will say for our part in student affairs, one of the things that we do is more sort of global programming for students, for undergraduate and graduate professional students, but we don't typically get as directly involved in discipline-specific areas. Although I will say, you know, one of the things that I have been focusing a lot on since I have been here at Carolina in August of 2020, recognizing that this mental health, first of all, is an area of significant area of focus and interest for me, and has been for many, many years now, going way back prior to my arrival at Carolina, and is as a result a focus of a lot of the development work that I do, because especially now, as a result of the multiple pandemics that we're navigating right now, we're just mindful that the need for mental health and well-being resources has increased 3- to 4-fold from what we were experiencing, and it was already high. And that's not something that you can fund exclusively, in my experience, through something like a financial resource that we have with our student health fee, for example. The need is extraordinary. And so a big focus of the development work, the fundraising work that I have been doing in my time here, is promoting mental health programming and resources, and in particular promoting the embedded counselor model that Avery's talked about, that Ed just reinforced. So that we mentioned to some of our colleagues and donors, who, particularly those who are interested in supporting a particular school or community, such as the health professions, know that there's a very direct link up for that, and to help develop those connections. So that's been something that I have talked about a lot. And I don't know if anyone, particularly Avery or Ed, based on your experience, can talk about the success and the resources offered through the medical school, or what we're developing right now in the School of Public Health, that may address this particular questioner's item.
I'm happy to start with that. I think particularly, so the medical school program, embedded counselor program, has been going for nearly 2 years now. Those therapists started in March of 2020, so they have had a very unique experience. But they have done a lot of work within the medical school of assessing the need, particularly around burnout and resilience. They have offered some groups and workshops, particularly targeted towards those students. I know a lot of their individual work has also focused on that. But additionally, one of the benefits of sort of these embedded counselor positions is they're also able to work with faculty and staff around sort of issues as they arise and what's being seen in the classroom or in internship or practicum experiences, as well as in order to then target services based on those things. So they offer workshops at really particular times in the academic year based on exams that are coming up and things like that to provide some additional support. But they're really able to sort of get into the culture of the program and really assess those needs. And as this program expands into the School of Public Health and places like that, that work will continue within those areas.
Thanks so much for that, Avery. Okay, so a couple of other questions provided by Caroline and I. They've come through in a list, so I think, although they look like they might all be sort of connected, I think they are separate, and I'll try to separate them for some coherence here. So the first question from registrants, is, what, if anything, has changed regarding the reporting of student suicide since the fall? I'm really grateful for this question because I think it helps address a lot of some confusion and some misunderstandings regarding the reporting of any student death, regardless of the source of it. So as do most of our colleagues across the country, Carolina, and I know this for a fact from having conversations with our colleagues in the ACC and SEC and at NASPA meetings that we've had very recently, most colleges and universities do not broadly address or have an announcement about any student death on campus for whatever reason. And particularly at large places like Carolina that has 30,000 students, the reason for that is very intentional, is that the vast majority of students around campus will not have had a relationship with that student, first of all, and the notification of that going out is often very triggering and troubling for students and is more harmful than helpful. So what we do, however, is reach out to the specific communities that we know that student who has passed away are affiliated with. So residence halls, clubs and organizations, academic units, we reach out very intentionally and specifically to those communities to advise them of the matter, to make sure that we're extending immediate support resources and talking to them about ways that we can help to avoid the sort of triggering impact of that death. We're also working very closely, as folks may understand, with the family that is affected. And that family often has very specific ideas about the way that they want that information to be shared or not. And so each one of these cases is individual, it is nuanced, but as most of our colleagues and universities, colleges and universities across the country, that is the Carolina's approach. I will say one of the things that I think has been a disadvantage to us is while we have at Carolina long had protocols and guidelines about how we handle a student death on campus, those have not been very publicly available like many of our peers do. And so one of the things that we're working on right now is a very public facing student death protocol document that shares, here's how we handle a student death, here's how you can support your communities, here are the resources available, so that information is not a black box for people. But that's the reason for that practice, what it is that we're trying to accomplish and how we're trying to support our communities. I hope that answers that question. Certainly glad to address anything further that follows if folks have it. The next question is, the most recent info on Stigma-Free Carolina, website is from 2019. Is Stigma-Free Carolina inactivity due to the 2020 to present pandemic? And I have to say, I don't believe that we run the Stigma-Free Carolina website. I don't know if any of the colleagues on the Zoom here are able to speak to that website and know why that information has not been updated. Avery, are you able to speak to that one?
Probably not as well. Somebody in the chat said that they have some answer to. My understanding is that it was a program done by some graduate students, and I don't know what the status of it is right now. But Laura, if you know something, that would be great.
Caroline, I don't know, can we promote Laura so that she can, from the graduate school, so she can perhaps address that one? There she is. Hi, Laura.
Hey everyone, thanks for inviting me to join as a panelist spontaneously. So my name is Lara Pratt and I serve as Fellowship Programs Coordinator within the graduate school. Stigma Free Carolina has been a student-run organization since it was conceived, and we have to have students to step up to lead that organization. This year we did not have any students step up to lead. We are hoping that next year things might be normal, and we can get back on track with offering those services. But it is certainly something that we do not want to see just disappear into the ether. So if there are any students on the call who are interested in joining that program, please send me a message. I'm happy to put my email in the chat.
That's fantastic, Laura. Thanks for your willingness to jump in with us and tag team. And a little plug for Stigma Free Carolina there. Please feel free to jump on others and promote other resources that, that folks may be interested in. That's really helpful. Okay, the next question is, what support opportunities can we promote to non-fee paying, part-time or off-model students that aren't covered for CAPS visits? So I appreciate this question very much. One of the things that I know that we are doing, and I believe will continue for the foreseeable future, and it looks like Avery may have gotten kicked out of the room there. She just sent us a note that she got kicked off the panel on Zoom. So hopefully she'll be able to join us here. But that we have allowed students who are interested in opting in to the student health fee, who wouldn't otherwise have access to the resources that the student health fee affords. We do allow those individuals, or have allowed those individuals, to participate. So I would say, I don't know whether this question comes from someone who is a student or someone who is a faculty or staff member, but if you have any students or who are interested in this, or if you are a student who is interested in this, please contact Campus Health to find out how you may opt in to paying the health fee so that you can access those resources. Avery, anything, I know you missed the first part of that, but we talked about opting into the health fee for access. Is there anything else that I didn't cover that would be useful to know based on your vantage point?
No, I think that would be the most helpful thing. The other thing is actually if there is someone who wants to get connected with therapy in the community, but they don't necessarily want to pay the health fee in order to do that, a student can send an email to our CAPS referral email. And one of the referral coordinators will ask some questions about sort of what you're looking for in a therapist and what health insurance you have and some of that sort of information. And then we'll provide a list of names of some therapists in the community that sort of meet that criteria and have experience working with university students and things like that. So that's a way for a student to get connected with services outside of CAPS or Campus Health if they're not paying the health fee.
I'll just quickly add too that we've tried to urge peer support programs who we've worked with to consider this particular population of students who don't pay the campus health fee for whatever reason that might be. And so many of them are open to supporting students in that role and are aware of the process and resource, Avery, that you just mentioned around CAPS referrals, supporting their connection to community care if they want something beyond and in addition to the peer support. So many of the programs are would be happy to support those students.
And I see a note in the chat that just popped up that's a follow-up, just the same thing that Avery said, go for staff at UNC too. I will be clear to say that CAPS is a student-based resource. So faculty and staff are not able to access CAPS. We have different resources for faculty and staff through the EA program and others. HR can help get connected, excuse me. I think I did connected and linked together there, connected. And also Peers for Progress, though, does have resources available for faculty and staff. Ed or Samantha, do you want to address that? That might be useful.
Go ahead.
Yeah, we are trying to encourage folks to make different avenues of peer support available also to faculty and staff in addition to students. I do have to admit there are not nearly as many as available for students, but there are some, for example, the support pod that I mentioned earlier around Asian identifying folks at Gillings. And then there are also some other groups across campus. I would love to see like more, and if anyone's interested in doing that, please chat with us. I do know that in addition to the EAP program that was just mentioned and connecting to clinical care, there's also the HR work-life wellness, which is run by Jessica Pydras out of the HR office, which offers a lot of different classes and education opportunities, as well as the run by the Wellness Champions to learn more about well-being and different parts of your health and participate in that.
Thanks so much. And Allison, I see, and it looks like Sarah has also put some useful information in the chat, the links to the HR website, and then the Heals Care Network resource, which does have faculty and staff opportunities also available there. So thanks to the dream team here for making that work. That's wonderful. Another question that we have received, it looks like through the anonymous chat, is how, it's not so much as a question and a statement, how to help our students process loss and grief. Many of them have been affected by student suicides and losses at home. Completely understand that. I'm hopeful that all of the things that we've discussed throughout our conversation today are resources that could help our students process loss and grief. We certainly also offer, Avery, do we still have a group for loss and grief? And clearly some brief therapy model would be a useful tool for them. Anything else that you might recommend there?
No, I mean, again, I can't plug enough our grief group. It's run by one of our outstanding therapists who's been doing it for years. It's a really long running group, and it's a huge asset to students that are experiencing grief, because often they feel pretty isolated in that experience because many of the folks around them aren't sharing that. And so to be in that shared space is incredibly powerful.
That's great. And here again on the Heals Care Network, there are some general resources about, questions to ask, how to provide some support that may be useful tools to the community as well in terms of helping our students process loss and grief. Thank you so much for that question.
And I just add that the Carolina Peer Support Collaborative has frequently addressed this issue in our discussions and shared information and ideas. And actually on the peer support core website, we have I think a 2-page document on how to address grief and how to help friends or family members deal with that I think some of our collaborative members have found helpful in circulating with their folks.
Thank you so much, group, everybody, for fielding that question. And then I think we have a last one here, although we may still have some others coming in. And it looks like maybe we have a few more in the chat, in the Q&A. The question from the chat is, are there any further updates on the new mental wellness course that has been developed for all first-year students? And I believe the questioner is asking about the Thrive course that is a part of the Ideas in Action general education curriculum that we have coming in the fall. And as I understand it, the focus on health and well-being more specifically, and I think sort of broadly in terms of resilience and issues addressing, such things as internet insecurity and food insecurity and housing insecurity, and array of topics are still very much planned for discussion in that course. I don't think we have anybody here from academic affairs who can speak to that more specifically. Certainly if you're in the room and would like to be promoted to responder, let us know. But my understanding is that's very much in the works. I don't know, Ed or Avery, if you have additional sort of insight to share on that particular curriculum.
Go ahead, Avery.
I don't.
No,
you covered what I know.
we worked extensively with Erica Wise, who was the chair of the mental health task force a few years ago. Erica's a faculty member in psychology who's really spearheaded, along I think with Abigail Panter, development of that course. And 2 of the 14 modules in the course address peer support and social connections. And and the importance of social connections. So I think that is really a spectacular development, because going forward, every student coming through the college will have had at least a little bit of exposure to the importance of social relationships, which too often don't get the recognition they need, and to some basic skills for how you can be a good friend, how you can be, if you will, a peer supporter. And so I think that's just a real terrific contribution, Amy, to the culture of care that you're wanting to promote on campus.
Appreciate that very much. All right, we have some other questions that have come in. One to the host and panelists here. What is being done at the start of the semester for incoming students to make them aware of these resources? My freshman wasn't sure what to do when the suicides happened last year. It may need to be teased out of all of the incoming student information given to them in its own space. I appreciate this question very much. One of the things that I think is a real boon and a blessing to us, if you can find anything out of the pandemics that we have been navigating here, is that we are talking about mental health and well-being. In my observation, after doing this work for 25 years, we are talking about this in a fundamentally different way than we ever have, and that it's a part of myriad conversations that we're having on campus. So I hope that things like the Heals Care Network, and again, this philosophy of the culture of compassion and care, which frankly, I think we have always had at Carolina. We're just talking about it and doing it, I think, much more intentionally than we ever have. I hope that these kinds of conversations are useful to that, to again, reinforce that we all have a role to play. We all have a job to do in terms of talking about this and keeping it very top of mind, talking the talk and walking the walk. So we absolutely, at orientation and our new student programming throughout the year and the work that we do in CAPS, hit these messages hard. And I know that our colleagues in the schools and centers also reinforce that, but I know that even more work is being done. And certainly things like the Heals Care Network and a website that is very public and readily accessible and an easy, I hope, a way to point and be a one-stop shop to the campus community about the breadth and depth of the resources that we have, makes it easy not only to sort of have this conversation, but to point people toward those resources and help them get connected in ways. So I think that this is what we're doing, both in terms of embracing this philosophy and keeping it at the tip of our tongue at all times and in every conversation, and reinforcing that it's perfectly appropriate, whether or not you're in a health profession or you teach math, to start every class, for example, with a conversation about how we're doing this week, and to keep the mental health and well-being of our community, again, at the very forefront of everything that we do. And there's not sort of any one place, I think, that we need to do this. I think it's in all places. And I hope that this conversation is one that reinforces that. Colleagues, anything that I didn't mention that you would add to that? I got a thumbs up from Ed. Oh, Avery, please.
Yeah, I think I'll add, we are constantly trying to figure out better ways to get the word out about CAPS. As Dr. Johnson said, we are present at things like orientation, Fall Fest, things like that, but we're also involved with the training of the RAs for our first year students to make sure that they know all about our services and how to walk a student through connecting. We also are part of training faculty or TAs on campus, so they also know about our services. So it's a continued quest that we have to make sure folks know. And as Dr. Johnson said, we're continuing to sort of search for those ways. So do appreciate the question.
Thanks so much for that. All right, some additional items through the question and answer feature. We have one here that says, curious about assessment methods for international students' mental health. I know we touched on this very briefly. Maybe we can go at it a little bit more directly. How they are being involved in these initiatives, how peer listeners are being sensitized to the special stress of navigating a highly demanding foreign language and cultural environment. Ed and Samantha, do you want to talk about the peer listeners and how that's being handled first?
Yeah, I just say that this is a real challenge that we're aware of, and Samantha can tell us more about the progress we've made, but we haven't gotten there.
I think it's always going to be a work in progress. And just because international student needs are just changing so much, we've seen that with just the change of the global landscape and different current events that have come up and been relevant for us. Specific to the Listen program, the Listen program is actually a result of a collaboration of many offices across campus, which has been really exciting, but that's also inclusive of folks at ISSS and Learning Center, people who are well-versed in supporting international students in both their academic and personal learning. And so with our collaborators, they identified international students specifically as one of the high priority groups they wanted to address with Listen. And so we've sought to recruit international students as listeners themselves, but also one of the requirements of listeners is to go through high priority group related training. And so they'll undergo some training to specifically learn about the experience of strengths of international students that they bring to the community and how best to support them. Still working on it. It's a work in progress, of course, but it's something that we really want to do. And if you want to get involved, always please reach out.
And Avery, do you mind talking maybe a little bit about how, from a CAPS perspective, you sort of keep a finger on the pulse of international students' needs, what we know about them, and how to address those?
Yeah, I mean, I would agree with what Samantha said. It's always changing and moving, and we're trying, constantly to sort of be connected with that, and it's a work in progress. We do have a staff member that has a great liaison relationship with the International Students Office. I will acknowledge that that this year we've struggled with that a little bit because she has been out on family leave. But we'll be back in about a month, which we are thrilled to have her back, and we'll continue that work. She has a real passion for work with international students and with continuing that liaison relationship with the International Students Office. So we have been both working not just to provide them good services at CAPS, but to think about what they need in addition to that. What sorts of groups and workshops do they need? In particular, during the pandemic, we were looking at what sorts of things do they need during breaks when the university is closed, but they were really mostly here because of travel restrictions and things like that. And so trying to provide additional programming and resources for those times. But I think it is sort of something that is always evolving and changing. And so we're trying to keep track of it as well. But we always want to make sure that international students know that they can come in, access CAPS services, that our therapists have experience working with international students and sort of addressing their unique challenges and needs.
Avery, don't go off mic. I'm coming back to you. We have another question in the chat that says, what resources are available to students who need to access off-campus mental health providers and can't do so, can't afford the cost? And I know we have some resources. Can you talk a little bit about that referral process and how we can get students connected to some additional financial support if they need it?
Yeah, absolutely. So that's really through that referral coordination process that I talked about earlier. Some of our therapists that have that particular area of interest and expertise, and they will really work with a student to overcome whatever barriers exist to get them the treatment that they really need that would be the most helpful for what they're presenting with. So if the concern is cost, we want to figure out how to overcome that barrier. That can look like a lot of different things. We do have some grant funding that's available to us. And so for students that qualify, we're able to use that grant funding to help them pay for therapy. But we also have things like some of the clinics that are operated either through the Department of Psychology or the Department of Psychiatry that offer really affordable, low-cost therapy for students. So we help them connect there. We also work with providers in the community that offer a sliding scale, or we'll talk with providers and ask if they will provide a sliding scale so that they can provide low-cost therapy to some of our students. But our goal is always to get as creative as we need to help the student get what they need, rather than have something like finances be a barrier. We never want a student to experience a barrier that prevents them from getting the care that they need. We want to sort of do whatever we can to make sure that they can access that.
Thanks so much, Avery. The last question that I see in the Q&A right now is, based on the Dean of Students website, there are only 3 staff that do this work and 1 case manager. Is there a plan to add more staff for them? As a parent, I worry how limited the staff is and how they would be able to help my kid. So I appreciate this question very much. There is, I think, no question but that we are a public research university with a low tuition model. Many schools, in my experience, have a fee that is specifically targeted towards supporting their Dean of Students team, particularly based on my experience at private universities. We do not have such an animal here at Carolina, and so have been sort of, I think, conservatively staffed in that area. We do have what I would describe as sort of a hub and spoke model, and it's one of the assets I think that Carolina brings to the table, is that we have a Dean of Students team. We also have, you know, the embedded coaches, wellness coaches, and counselors that we have talked about, who also do some case-based work, and some other colleagues who work in student affairs in the schools and colleges that we have at Carolina who support that work. We have our housing team, which also has professional staff that live in all of the residence halls who assist us in this work. But we are talking about how we fundamentally expand that Dean of Students team and do so in a way that doesn't cost our students more as much as possible, to try to find that right balance. I expect we'll continue that hub and spoke model, have it be a yes and, but we are looking to find ways to add more resources to our Dean of Students team, because there is no question that group has been relied on heavily, particularly during the pandemic, with a whole new set of responsibilities and resources to support our students' needs. We also have partners that report up through that Dean of Students team in our university approved absence office, in our Veterans Resource Center, who also serve sort of specific functions and populations that are resources. But could we use more staff there? Yes, and we are regularly assessing the needs and how we can best respond to that. So I appreciate that individual's question and noting that very much. Thank you. I wish I knew who you were so that I could come to you for some direct support and advocacy. All right. It looks as though we don't have any more Q questions, unless we have folks who would like to pop something else into the Q&A or chat. I will stall here for just a moment and do a little dance so that hopefully, okay. There is a comment, and it looks like maybe a question that I'm seeing in the Q&A. I'll just read this to the group. First of all, it's an appreciation to folks for the program, it appears. The person says, I'm in audiology, so we're a super small program. Our students are superstars, but I do feel that there's a level, and now I'm saying don't read that out loud. Okay, so I think one of the things that this person points to, which I will not read the further question, is that our students are experiencing fatigue and burnout and are struggling. And for many students, what we know is that the return to an in-person experience has been welcomed by many, but it brings its own tensions and stress and anxiety for students. And so it is here again, sort of a yes and so that's one of the things that I think various folks have been responding to and writing to the hosts and panelists in the chat so that we can be aware of that. And I just want to assure that we let the room know and all the participants know that we are very much aware of that. And frankly, it's one of the, again, the reasons why we are talking about this issue regularly and often and out loud, and making sure that there is a campus-wide approach to address this problem, and that we reinforce that there are many doors through which students can come to be able to access support and resources, many doors, many different opportunities to get connected and get help. All right, so thank you for that, and I apologize for that attendee that I was reading their question when maybe I wasn't supposed to. All right, but it was anonymous, so hopefully that's of some support. Anything else that folks would like to pop in the chat or the Q&A?
I just think that a webinar with this much energy and participation and questions, I guess it's no longer the last week of classes on reading day, is really a testimony to what we're all talking about here, and that is trying to create a culture of care on campus. So bravo to everybody.
Thank you for that, some of Ed. That's very kind. I want to say a couple of quick things, sort of some parting notes. First of all, I would like to very much thank the superstars behind the scenes who are with us today, Allison Reed, Sarah Stallman, and Caroline Carpenter, who are working to make all of the rest of our jobs easy. If I could take their cameras off so that you could look at them personally, I would do so, and we could honor them. But a tip of the hat to you three, and really to Ed's point, all of our colleagues across campus. I know some of you are in the room. I know some are unable to be here, but please, everybody who does this work, and that is really the campus, we want to thank you again for the partnership and just the teamwork approach that we are all adopting to wrap arms around our students and each other in faculty and staff. This takes a village, as they say, and the village is coming to the table. So thank you so much for that. Thank you to everybody in the room. I have to say, I think we started with more than 50 folks. We anticipated, based on the responses that we were hearing about, maybe not a good time for the colloquium, that we could have a very small turnout today. We know it's a busy time of year, so thanks for so many of you for joining us and the wonderful questions that you asked. Please help us spread the word. We will be, as noted, hosting a colloquium in the fall, so stay tuned for that. We are working on a date now, and we'll be doing, as planned, a half-day, again, rather than a debrief now and a bookend event, a kickoff event for academic year 22-23. We will be continuing our mental health seminars that we talked about earlier in the program. So look for more of those to come. And we hope during the colloquium we can get some more great ideas, as we did in the summit, about topics of interest for our community. So that will be coming. And then please do go and check out the Heals Care Network website and promote it widely to your communities, your friends, your students, because we think that's just a terrific resource, and help us keep it that way by making sure that we're regularly adding information, keeping things fresh, and augmenting that with resources throughout the coming years. So with that, not seeing any other questions today, we will close. Appreciate everyone's participation. We did a full hour and a half, gang. Thank you to everyone for being a part of this program and being in the room, and look forward to continued more conversation about the health and well-being and supporting a culture of compassion and care at Carolina. Have a good day, everybody.
Take care, everybody.